Imagine you are cleaning out an old storage room. Maybe it is a cabin you haven't visited in months or a garage that has been shut all winter. You sweep the floor, disturb some old dust, maybe notice a few mouse droppings in the corner. You don't think anything of it. You finish the job, wash your hands, and go about your day. But 1 week later, you wake up with a fever. Your muscles ache so badly you can barely get out of bed. You feel exhausted in a way that sleep doesn't fix. You think it's the flu. You take some medicine and rest. But then, a few days after that, something changes. You start struggling to breathe. Your chest tightens. You rush to the hospital, and the doctors tell you something that stops your heart cold. Your lungs are filling with fluid, and the cause is a virus that has no cure. That virus is Hantavirus. And that moment in the storage room, that single act of sweeping dusty mouse droppings, was all it took. Hantavirus is a rare but potentially dangerous rodent-borne virus that can cause severe lung or organ problems. It does not make headlines every day. It does not spread like the flu or COVID-19. But when it strikes fast, it strikes hard, and for nearly half of the people it infects, it kills. Today, we are going to walk through everything: where this virus comes from, how it has moved through history, how it enters the human body, what it does once it is inside, what the consequences look like, and most importantly, how you can protect yourself and the people you love. This is the complete story of Hantavirus. Hantaviruses are not new. Their discovery dates back to the Korean War in the 1950s, when thousands of United Nations soldiers fighting in Korea began falling mysteriously ill. They developed high fevers, severe headaches, kidney failure, and internal bleeding. Military doctors were completely puzzled. They had never seen anything like it. They knew something was killing these men, but they could not identify what. For years, this mysterious illness was simply called Korean hemorrhagic fever, and it remained one of medicine's unsolved problems. It was only decades later that scientists managed to isolate the virus responsible. The virus was eventually renamed Hantavirus, after the Hantan River, a tributary of the Imjin River, which crosses the demilitarized zone separating North and South Korea. That river and the rodents living along its banks had been silently harboring this deadly pathogen all along. The World Health Organization formally classified hantaviruses in 1987, but it wasn't until a 1993 outbreak in the Four Corners region of the United States, where Arizona, Utah, Colorado, and New Mexico meet, that hantavirus pulmonary syndrome was discovered, splitting the virus into two major subgroups: Old World strains, which cause kidney failure, and New World strains, which cause pulmonary failure. That 1993 outbreak shocked America. Young, healthy people, hikers, farmers, families, were dying within days of developing what looked like a simple cold. The culprit turned out to be deer mice living in and around their homes. Since then, the virus has been found across the Americas, Europe, and Asia, and scientists have identified over 40 different strains of it in nature. Now, to truly understand how hantavirus reaches humans, you need to understand its original home, the bodies of rodents. The reservoir, or natural source, of hantaviruses that can affect humans are rodents. For the most part, each type of hantavirus has a specific rodent host. These viruses and their rodent hosts appear to have co-evolved over thousands of years, and the viruses cause lifelong infections in the rodents without causing any apparent illness in the animals themselves. The mouse carries the virus its entire life, never sneezes, never shows any sign of sickness, and goes about its daily business completely unaware. All the while it sheds the virus constantly through its urine, its droppings, and its saliva. Every place the mouse goes, every surface it touches, every corner it nests in, it leaves the virus behind. Human-built environments play a major role in how hantavirus moves closer to people. Deforestation and excess agriculture destroy rodents' natural habitat. The expansion of agricultural land is associated with a decline in predator populations, which allows hantavirus host species to use farm monocultures as nesting and foraging sites. Agricultural sites built in close proximity to rodents' natural habitats can facilitate the proliferation of rodents as they may be attracted to animal feed. Sewers and stormwater drainage systems may also be inhabited by rodents, especially in areas with poor solid waste management. In other words, every time we cut down forests, build new farms, expand into rural land, or fail to manage our waste properly, we are essentially rolling out the welcome mat for rodents, and with them, Hantavirus, to move right next door to us. So, how does the virus actually get from the rodent into your body? This is where things become genuinely alarming, because the routes of transmission are more common and more everyday than most people realize. The primary route, the one responsible for the vast majority of infections, is simply breathing. The virus, found in rodent urine, saliva, and feces, can be easily released in the air in confined spaces when disturbed by rodents or human activities such as sweeping or vacuuming. Breathing in the virus is the most common way of getting infected. When dried rodent droppings are disturbed, even something as simple as sweeping a floor or shaking out an old blanket, microscopic virus particles become airborne. You inhale them without even knowing it. There is no smell, no visible cloud, no warning whatsoever. You just breathe, and the virus is inside you. The second route is through touching contaminated surfaces. People can also become infected by touching their mouth or nose after handling contaminated objects or surfaces. You move a box in an old storage room, your hands come into contact with dried rodent waste, and then you touch your face, which all of us do dozens of times every day without thinking. That is enough. A third route, though less common, is through eating contaminated food. The virus can infect humans if they eat contaminated food. Rodents frequently contaminate grain stores, open food packages, and farm produce, leaving the virus on anything they touch or nest near. And finally, though it is rare, a rodent's bite can also spread the virus. Now, most strains of hantavirus cannot spread from one human to another. Once you are infected, you are essentially a dead end for the virus. It cannot jump from you to the next person. But there is one critically important exception, and it is the strain that caused the 2026 cruise ship outbreak that alarmed the entire world. The Andes virus is the only type of hantavirus known to spread person to person, and this spread is usually limited to people who have close contact with the ill person. Based on investigations of past outbreaks, the window for transmission of the Andes virus appears to be short, about a day. People are at their peak of infectiousness on the very day they develop a fever. Close household contacts, intimate partners, and caregivers of infected patients are at the highest risk. This is what made the cruise ship situation so terrifying. A closed, confined environment, a person-to-person transmissible strain, and passengers with nowhere to go. Once the virus is inside your body, it begins working in silence. Hantavirus enters the body almost exclusively through inhaled particles. Once inside, it targets the cells lining your blood vessels and lungs. The destruction is not immediate. It unfolds in stages. For the first several days, you feel what seems like an ordinary flu. Symptoms include fever, extreme fatigue, muscle aches, stomach pain, nausea, vomiting, diarrhea, and possibly some shortness of breath. You feel terrible, but nothing about this phase screams emergency. This is exactly why hantavirus is so dangerous. Early symptoms such as fever, headache, muscle aches, nausea, and fatigue are easily confused with influenza. Patients go home from clinics. Doctors send them away with flu medicine. Days are lost, and during those lost days, the virus is quietly doing something catastrophic inside the blood vessels of the lungs. Then, this is where hantavirus becomes truly life-threatening. Fluid floods the lungs. Blood pressure drops. The heart struggles to pump. Patients deteriorate from mild shortness of breath to ICU-level respiratory failure within hours. Most deaths occur during this phase. When hantaviruses reach the lungs, they invade tiny blood vessels called capillaries, eventually causing them to leak. The lungs fill with fluid, resulting in severe dysfunction of both the lungs and the heart. The patient cannot breathe on their own. They need a ventilator. In the most severe cases, they need an ECMO machine, a device that literally takes over the entire function of the heart and lungs from the outside, buying the body time to try to heal itself. Even with all of this, many patients do not survive. For those who make it through, the battle is not necessarily over. In the old world form of the disease, later stages may include low blood pressure, bleeding disorders, and kidney failure. Recovery is slow and exhausting. An increased risk for dangerous blood clots has been reported in the weeks following Hantavirus infection. Various studies have also suggested that some Hantavirus infections may predispose patients to the development of high blood pressure long after the acute illness has resolved. Some survivors deal with fatigue, hormonal imbalances, and reduced kidney function for months after leaving the hospital. The virus leaves a mark on the body long after it is gone. Fatality rates range from 1 to 15% for Old World strains, while New World strains carry a fatality rate of up to 50%, even with treatment. Worldwide, it is estimated that between 10,000 to over 100,000 infections occur every single year. And because the early symptoms so closely mimic the flu, a significant number of infections are likely never diagnosed at all. People often assume that hantavirus only affects people who live in rural areas or sleep in the wilderness. That is a dangerous misconception. Even clean homes and cabins can pose a risk. If rodents are present, the virus may be there too. Among documented cases of Hantavirus pulmonary syndrome, patients with potential occupational exposures have included grain farmers, field biologists, and agricultural mill, construction, utility, and feedlot workers. Many of these individuals also had household exposures. Hikers, campers, people renovating old buildings, pest control workers. Anyone who comes into contact with spaces where rodents live or have lived is at risk. You do not need to hold a mouse in your hands. You just need to breathe the wrong air in the wrong place at the wrong time. So what do? How do you protect yourself? The answer starts with one simple truth. There is no vaccine, no cure, and no specific antiviral drug that has been proven to work against the most deadly forms of hantavirus. Patients must receive supportive care, including rest, hydration, and treatment of symptoms. Early medical care is critical, which means your best defense is prevention. The first thing you must do is keep rodents out of your living and working spaces. Seal holes and gaps in your home or garage to keep rodents from entering. Place traps in and around your home to decrease rodent infestation. Clean up any food that might attract rodents and store everything in rodent-proof containers. Mice can squeeze through a gap the size of a small coin. Inspect your home thoroughly and seal every crack, gap, and hole you find. Pay special attention to areas around pipes, vents, and the foundation of the building. When it comes to cleaning up after rodents, the method you use is just as important as the act itself. Never dry sweep or vacuum rodent droppings. Doing so launches the virus directly into the air you are breathing. Wearing rubber or plastic gloves, wet down the debris thoroughly with a disinfectant solution, such as 1.5 cups of bleach mixed in 1 gallon of water. Wipe up the sprayed debris and place it in plastic bags for disposal. Do not use vacuum cleaners or sweep with brooms. Wear disposable gloves, dust masks, long-sleeved clothing, and protective eyewear to help prevent personal exposure. Wash hands with soap and water after completing the cleanup. Before beginning any cleanup in a space that may have been rodent-infested, open doors and windows to air out the enclosed space for at least 30 minutes. If the infestation is heavy, large amounts of droppings across a wide area, do not attempt to clean it yourself. Call a professional pest control service. The risk is simply too high. Snap traps are among the most recommended tools for rodent control. Avoid using glue traps or cage traps because these can scare rodents, causing them to urinate and defecate in a panic, which significantly increases your exposure risk. Once a rodent is caught in a snap trap, Wet the trap and the rodent with a bleach solution before picking it up with gloved hands, and seal everything in a double plastic bag before disposing of it. And finally, if you have recently been in a space where rodents may have been present and you develop fever, muscle aches, or any difficulty breathing, do not wait. See your doctor immediately and be sure to tell them that you have been around rodents. This will alert your physician to look closely for any rodent-carried disease such as Hantavirus. The earlier the diagnosis, the better the chance of survival. Every hour counts once the cardiopulmonary phase begins. Hantavirus has been living alongside humanity for thousands of years. It has killed soldiers in war, farmers in their fields, families in their homes, and passengers on a cruise ship in the middle of the ocean. It is rare, but when it comes for you, it comes fast, it comes without warning, and it shows no mercy. There is no second chance once your lungs begin to fill with fluid. But the knowledge you now have about where it comes from, how it spreads, what it does to your body, and how to stop it, that knowledge is your shield. Respect the virus, take the precautions seriously, and share this information with the people around you, because awareness is the only vaccine we have against hantavirus today.